Thank you, Carla. That's truly an inspiring path that you've been on. And it's a great segue for our next talk. Next up, we were fortunate to have Dr. Georgiana Tang. She is the medical director for City Fertility Center here in Sydney. She graduated in 1992, specializing in OBGYN, but she's been practicing reproductive medicine for the last 15 years. Dr. Tang will present on one of the most important decisions a woman may face over her lifetime or her fertility journey, and that is when to consider making the shift to donor eggs. She'll also talk about positive prognosticators to consider in potential egg donors. Dr. Tang.
Good morning. I'm going to talk about egg donation with you this morning, and I'm going to talk about the medical basis of the things you know that you need to know about egg donation. Now, for those considering egg donation, it is probably the most important, one of the most important questions that you need to ask yourself whether you want to proceed. Now, for a lot of gay couples and heterosexual couples, it is a very big dilemma for you to consider egg donation. Now, for women who have repeated unsuccessfulness using your own eggs, it is also a very big decision as far as whether you need to continue to do more treatment cycle with your own eggs and when it is the right time to go ahead with egg donation. Now, a lot of people will ask themselves, what are the importance of the characteristics of the egg donors that you should consider, and what are the factors that will influence your success with using donor egg? And therefore, I'm hoping that with after this presentation, that all these questions can be answered. When is it the situation that people will consider using donor eggs? Women who have premature menopause, people are at risk of passing a genetic disease to their offspring, or women who have ovarian failure due to radiation or chemotherapy for malignancies, and also if women have history of having had their ovaries removed, should consider using donor eggs. Women who are in advanced age, who have been shown to have a compromised ovarian function, should consider donor eggs. Women who have repeated unsuccessful IVF attempts, who indicate that they have poor ovarian response and poor quality of embryo, should consider using donor eggs. Women who have non-functioning reproductive organs should consider donor eggs. Same-sex male parents will need to consider using donor eggs and with the help of a surrogate. How do you choose the appropriate egg donor for yourself? Quite often for women who have repeated attempts, it is a very hard decision to come in terms with the fact that you cannot provide your own eggs to pass all your own genetics to your offspring. And this is often a very difficult thing to accept and to come in terms with, and you need to discuss with your partner. Choosing an egg donor for some people can be a very simple choice, but for others it is one of the most complicated and difficult decisions to make. In Australia, I've already mentioned from the last speaker that it has to be altruistic. Altruistic, meaning that there is no commercial arrangement possible in order to find your egg donor. Because of this reason, there are quite limited egg donors available, and quite often patients who come to see me for advice, when I advise them to have egg donor, and most people's initial response will be, I don't have one, or I don't know anyone, or they'll say, look, how do I find one? So it is quite often a very difficult dilemma that a lot of my patients have to go through. So therefore, because it's so hard to find an egg donor, when you find one person who's willing to consider donating their eggs, therefore your criteria for selecting your egg donor become very simple, because this person who's willing to do it, that is your egg donor. So if there are a number of choices, There are various ways of choosing your egg donors. Some people prefer known egg donors, meaning that they may know a friend or relative who is willing to donate. Some people prefer anonymous. Actually, it is not true anonymous, because the identity has to be known to the doctors and nurses, and also to the New South Wales Central Register in New South Wales. We'll talk about that later. But the identity of the egg donor is anonymous to the recipients, yes. There is altruistic versus commercial, and patients may elect to go overseas for commercial egg donation, but in Australia, as medical doctors, we are not allowed to assist in any form of commercial egg donation and surrogacy. Some people choose to do egg donation locally or choose to have their treatment done overseas. Of course, apart from choosing your egg donors, the cost is a very important issue to a lot of people. And remember, the costs will include your initial consultations, the investigations, the extensive screening tests. There's counseling involved, and there's also involved treatment to cover the costs of the egg donation procedures, and also your own treatment as a recipient to receive the donor egg. When people consider doing their treatment overseas, there's quite a whole list of costs that you need to consider, and it is often will all add up into the equation. So about doing it locally or overseas. Now, if there are choices, if you've got a choice of egg donors, the importance of the donor's physical attributes is highly an individual choice, and therefore it is important to think about what's important to you, for you to determine what are the characteristics that's in the egg donor that makes this egg donor appropriate for you. Now, what are the physical characteristics that a couple may consider when they choose an egg donor? Some people may consider that ethnic background is a very important factor. Physical characteristics, their external appearance, their height, their build, their hair color, their eye color, their age, their education level, IQ, smoking status. For a lot of people, these may be the factors you want to consider who is the best egg donor for you. What are the medical factors that couple may consider when they choose their donor egg? Now, it may be helpful to find out if this egg donor has had previous successful egg donation, and the number of cycles this egg donor has provided in the past, how many times she has been used as an egg donor. In New South Wales, there is a limit of how many families that an egg donor can be involved in creating family, including her own. So sometimes it is important to check with your own state your laws and regulations regarding the requirements involving egg donation. As far as the background and the medical information about the egg donor, it may be helpful to find out how many cycles resulting in positive outcome and versus the negative outcome from her egg donation, and how many eggs are involved have been collected during her donation. Now, for some people, the final details may be important to some people as well, such as their personality trait, their work, the artistic and sporting abilities, you name it. But I suppose when you've got a great range to choose from like that, that would be wonderful, but in practice, it is actually quite hard to find an egg donor. Now, the big question we need to ask ourselves as far as finding the egg donor is how much of who we are is determined by our genetics, and how much of who we are and what we are determined by our environmental factors and the way how we brought up. Now, there has been quite interesting study that has been done where they look at identical twins that has been separated from birth, that has been raised in different environments. And therefore, these studies basically look at the personality and other types of characteristics of these twins, And the conclusion is the experts can't determine what are the factors are totally controlled by genetics and how much is controlled by the environmental factors. But the interesting thing is, even in these separated identical twins, that there are more similarities than you would expect compared to what you expect by chance. So there is probably the combination of both genetics and environmental factors. So therefore, couples who need egg donation, they need to decide for themselves the relevance of these types of characteristics in the donor towards a successful outcome. Now, once you found your egg donor, how do we test the egg donor, or what do we need to find out about this egg donor? Well, there should be screening there to serve the purpose to protect all parties, which is the donor, the recipients, and also the resulting offsprings. When egg donors come to see us, we require the egg donors to fill in genetic and medical health questionnaires so that we get as much information as possible about the background of the egg donor medically. Overall, the donor age should be generally younger than 35, maybe 37. The lower cutoff for EDA is above 18, so the range is about 18 to 35. Having said that, age is only one factor, and someone will question, okay, what's the maturity and the background and the social and the emotional circumstances of an egg donor? So therefore, it is not just an age factor, but there's quite many factors to consider. Having said that, age is only one thing. Of course, there are other factors such as her ovarian reserve, and also that there are younger women out there who have impaired fertility potential as well. So age is only one of the factors. What are the donor medical traits that most contribute towards success? And we know that a successful pregnancy outcome heavily relies on the egg quality. Poor egg quality will result in poor embryo quality, which will reduce the chances of you becoming pregnant with a successful outcome. How do we test for egg quality if it is the most important factor that determines success? Well, the difficulty is when women recruit a batch of eggs in different months, different eggs are individual and different, and there is no such test as an individual egg quality on its own. But there are tests available to test for women's ovarian reserve. And the common testing that we do on potential egg donors or women who want to pursue their fertility potential include the day 3 FSH testing, the AMH level. AMH stands for anti-Mullerian hormone, which is one of the newer popular tests these days we do on a lot of women to assess their ovarian reserve. There's also another method, which is the andro follicle count, which is an ultrasound testing of women in the beginning part of the cycle around the period time as an indicator of her ovarian reserve. And all three tests probably test for similar things, not exactly, but they are helpful tests to help us to determine what's the ovarian reserve of the potential egg donor. Now, there has been quite many studies published, and I've picked two from journals from human reproduction. They've looked at the factors that affect the success in oocyte donation. Basically, these two papers look at a number of factors that may matter, and this particular one look at the number of eggs that's retrieved, and they look at the gravity of the donor, which is how many times she's been pregnant. They look at the parity, which is how many times these women have given birth to a child, and also they also study the age of the donor, and they look at all these factors to see how they influence the outcome of pregnancy in this scenario. And the conclusion from this study suggests that the age of the oocyte donor is the significant predictor of pregnancy outcome as far as using donor egg is concerned. And when they look at the gravity and the parity of the egg donors and the number of oocytes, they end up not being important when they adjusted for the donor's age. And they also look at the age of the recipients, of the woman and also the male partner, and both factors have no significant influence on the outcome. So, what are the important factors that contribute to the success rates of using donor egg ART? Well, we've already spoken about the importance of the age of the egg donor. But of course, egg is only one half of the equation of the baby making situation. The quality of semen is very, very important as well. Apart from those two very important factors, the overall health of the donor, so age is one thing, but her health condition, her BMI, her diet, her exercise level, they are probably as important compared to other factors. The overall health of the recipient is very important. What is the status of her uterus? Is she capable of carrying the pregnancy when donor eggs in use is important. The quality and the number of embryos transferred is important as well. And there are units who may transfer more than one embryo back. In Australia, the RTAC guidelines and policies suggest that single embryos should be transferred to maximize the success without compromising the risk of high multiple pregnancies. Now, of course, as a consumer or recipient, it is important for you to find a reputable, high-standard fertility center that can provide you with good care, with good individual success rate, and the individual IVF unit success rate heavily depends on the team's work, on stimulation regimen, the egg collection technique, insemination technique, embryology, culture techniques, and embryo transfer techniques. Now, the age of the recipient we already discussed that is not a very big important factor that affects success. However, overall, the RTAC guidelines suggest that the recipient should be under the age of 50. There are rare circumstances when we may consider the age limit. It depends on the circumstance, but overall, this is the guidelines. And in Australia, most ART units will recommend or treat women who, that we can only treat when you have not passed your reproductive age and you have not gone through menopause. What are the regulations in New South Wales? In the year 2010, New South Wales Health Department has established a central register for donors and donor-conceived offsprings, and this is a register that needs to record for this purpose. It is not for the public to view, but it is available for the offspring once the offspring has turned 18. The New South Wales Health Central Register contains information about the donor and the children born as a result of ART treatment using donor gametes. And this is the same situation for donor sperm, same situation for donor eggs, and similar situation for donor embryos, and you need to be aware of that. Now, there's also individual ART units responsibility to report to RTAC, which is the governing body for accreditation of all ART units in Australia, and it is mandatory reporting to the New South Wales Central Register when donor gametes are used.
Dr. Tang, 5 minutes.
Thank you. Now, it is quite interesting to compare Australia to other parts of the world as far as the limitations and the rules and the policy. And I've listed on the left side the countries that have law that says that we need to provide information to the offspring from the donor, and Australia is one of them. And it's interesting on the right side that there are countries who actually have law to protect the anonymity of the donor as well. And in India and US, for example, information of the donor can be accessed by court order. So it's quite interesting to compare how the different countries have different policies and recommendations as far as using donor egg is concerned. So, the second important question is, how does a woman decide when it is time for her not to try with her own eggs and want to consider using donor egg? We know that age of the age of the woman using her own eggs is heavily dependent on her age, and we can see that the success rate declined rapidly from 40% in her 20s to 30% when she reached 38, and dropped down to 10% when she's about age 43. So therefore, as far as using donor eggs is concerned, when donor eggs are used, the success rate actually is similar for the older and younger age group of the recipients. And overall, when donor eggs are used, the overall success rate is excellent, irrespective of the recipient's age. So, to answer the question, when is it the right time to give up not using your own eggs and consider egg donations? It heavily depends on individual circumstances. So of course, everyone's emotional, physical, financial toll is going to be different, and your resources may be totally different. Overall, if you are using your own eggs and you've had more than 3 attempts, it is totally justifiable to continue trying, for example, with a defined and new approach that can possibly address the possible reasons behind the prior failures. And when is it the right time to stop? Well, it is the right time to stop when there's no remediable explanation for repeated failures to achieve a viable pregnancy. So, the very important question, you should find a specialist with good knowledge who provide excellent care to discuss your case individually, because each case is unique and individual, and there are so many factors that can heavily influence. So, and in conclusion, it is in order for you to consider egg donation, it is before you make the very important decision, you need to consider all the factors that I have raised here. And for those who want to pursue surrogacy and donor egg, I do wish you all the best, and hopefully your dilemma can turn into a positive experience, giving you your goal and outcome. Thank you very much.
Thank you, Dr. Tang. Thank you, Dr. Tang. We really appreciate the talk. I think it's very insightful. Next up, we have Dr. Michael Feynman from Huntington Reproductive Center near Los Angeles. Dr. Feynman has been a pioneer in reproductive medicine, performing one of the first transvaginal egg retrievals in the U.S. and developing one of the first anonymous egg donor programs. His presentation will be on pre-genetic testing. He will talk about advantages, disadvantages, and also the ethics.